Hi, welcome to the Medical Software Associates presentation of the MicroMD EMR with Dragon Medical integration. Because of the integration with Dragon Medical into the MicroMD EMR, we're able to utilize voice commands to access and navigate through the system. We are also able to document patient visits so that we have custom and precise patient encounter notes, which gives us the ability to do away with any outside transcription costs. This presentation will show you the efficiencies gained by documenting patient encounter visits, as well as efficiencies in processing phone messages and other items in your desktop navigator. Let's begin with scheduled visits. Click Open Encounter. I can see the reason the patient is visiting the clinic today, and I can proceed from this point. Click Edit. If needed, I can navigate through to see what information the patient has already in his chart, utilizing dashboards or accessing medical information. You can also build this into your encounter as one of your steps if that's desired. In this case, I'm going to continue with the encounter visit and just demonstrate the Dragon components. Go to End, Macro Exam. You're able to store as many exam templates as macros as desired. Your Dragon Power Mic has navigation buttons that can be configured to quickly take you through these square bracket markers, which allow you to navigate and add or delete components in your note quickly. In this exam, I have all of my expected normals throughout the different body systems, and I can just add as needed to the different sections using my navigation buttons. Peter is a 50-year-old male that has been using ProAir inhaler more frequently over the past 3 days. Peter states that he has been using it every 3 to 4 hours but is not getting the expected relief, period. Peter describes the onset Peter describes the onset of sinus issues about 1 week ago that seem to be getting worse and have been draining into his chest over the last 3 days, causing discomfort, period. Peter also complains of a sore throat, period. The patient's biggest concern is his inability to, quote, fill his lungs with air, end quote, period. The patient is escorted by his wife, Jennifer, period. And I can continue navigation. I can also go back and take out items like this, scratch that, and continue navigating through my exam components. I want to replace this text with information that better describes this patient's condition. Tonsils are red and swollen, period. The throat is irritated, period. And I continue navigation and replace items as necessary. Auscultation revealed rhonchi, wheezing, and diminished breath sounds bilaterally, period. Once I've navigated and edited all the components that I wish to, I would have the ability to quickly remove the square bracket markers you're seeing here with a button on my Power Mic. Let's first document the impression and findings. Of course, this might happen later in the exam. However, for the purpose of demonstration, we're going to go ahead and do that now. Chronic bronchitis with bacterial exacerbation, period. Increased sputum production, period. Increased dyspnea, excessive secretion production and possible pulmonary infection, period. Acute alveolar hyperventilation superimposed on chronic ventilatory failure, period. Bilateral chest x-ray ordered and performed in office revealing evidence of chronic bronchitis, moderate inflammation, period. O2 sat was 97% on room air, period. Pulmonary function testing was performed, FEV and FVC is lower than normal and expected. However, the patient exhibited minimal effort as he felt weak, period. Order for nebulizer treatment given in office, and then pulmonary function testing was repeated with improved results, period. Patient has been prescribed Bactrim BID for 10 days and will continue his ProAir every 4 hours for the next 3 days, then as needed every 4 to 6 hours, period. Lab order for CBC and ABG, period. Patient to follow up in the office in 3 days to repeat pulmonary function testing and O2 sat, period. Patient instructed to call 911 if he has any episodes of chest pain, difficulty in breathing, or any other priority symptom, period. Now that I'm done documenting my Dragon components, I can use Dragon voice commands to navigate through my note. Click Next. So you can see I don't have anything in my tabs currently because I haven't loaded any templates. The simplicity of using Dragon is to quickly voice dictate my exam, HPI, review of system items, even impression finding, and then use templates to document my assessment, medication, and plan. So in this case, I have a patient where I've said he has bronchitis, which will include my assessment, medication, and plan items. I've also ordered spirometry and a nebulizer treatment, so I'm going to add that. We've ordered a CBC to check for the infection. And one other thing I can take into consideration is that I may have meaningful use items, like this patient has persistent asthma and has medication that's been prescribed. So I can add my meaningful use components to comply with that measure, as well as adding the PQRS measures to quickly comply with all of these items at one time. So in this case, not only am I adding my procedure orders, my assessment, medication, and plan for the diagnosis, but my lab orders, meaningful use, and PQRS all at one time. I can see that the patient has his diagnosis for acute bronchitis, but I want to make sure that the patient's asthma is also noted, and I'm simply going to find it in my list. Next, I want to make sure to add my patient's Bactrim that I ordered in my objective exam. I'm not going to read the drug warnings, of course you would, but I'm going to go ahead and prescribe anyway. I've already added the SIG details that include the dosing, the duration, and my refills. And finally, I'm going to come to the patient plan items, which include procedure orders, where you can see spirometry and nebulizer treatment are already set. I've also ordered the CBC, which is already noted as a selected item as part of the orders. And you can see several instructions and measures which are completed based on me choosing my meaningful use and PQRS templates. These are going to give you your G codes and other codes that are required for your claims processing for meaningful use and PQRS. With everything completed, I'm going to navigate using Dragon to finish my note. Click Finish. It takes me into my bill builder where I can do a number of things. I can look at an encounter report, and I've created a custom demo encounter report to display for you. And I'm doing this intentionally because remember I talked about the markers within my note, the square brackets that you're still seeing. And those remain unless you make sure to remove those. So I will return quickly to my encounter. When you're in the exam component or your Dragon template, once you've completed all your Dragon items, you're going to use your quick command button, a simple click just like this. And let me scroll down where you can see a few more brackets. So here you can see multiple brackets. And by clicking a button on my power mic, I can remove those brackets. Now, when I go into my preview of my encounter through the encounter report, I have a clean professional note that is absent of the brackets. Additionally, all of the diagnosis codes, medication, plan items, all are pulling in based on the configuration of my report template. I also have appended certain education material which could be processed. And you'll note under quality measures when I refresh, there are going to be multiple items that will process as a result of choosing our PQRS in our meaningful use items. Once I've completed, I simply navigate through the note to go on to my next patient. Click OK. Click Close. Click arrow down. Click Open Encounter, and I move on to my next patient. I'll do this one without explanation. Click Edit. In this exam, we'll have a patient that gave the nurse a single symptom but provides additional to the provider. Go to End. Macro exam. Anthony is a 63-year-old male with a history of well-controlled diabetes mellitus 2, period. Anthony also has controlled mild hypertension, period. Anthony presents today with a complaint of very noticeable hearing loss in his left ear, onset approximately 1 to 2 weeks ago, period. Anthony states it is becoming painful and that his ear, quote, feels full, end quote, period. Patient also states, scratch that. Anthony states that he has had a rash on his left elbow and behind his knee for about 2 weeks also, period. He has been treating the rash with over-the-counter anti-itch cream and hydrocortisone, but does not feel that it is working and believes the rash is continuing to spread, period. Right ear is clear, comma, no redness, comma, eardrum is intact, period. Left ear has severe cerumen impaction and is red with no sign of infection, period. The left eardrum is intact, period. The left elbow front crease has evidence of rash, as does the back of the patient's left knee, period. There is also evidence of rash beginning on the trunk and both lower extremities, period. There are multiple papules and vesicles on an erythematous base, comma, over the flexor surfaces, period. These range in size from 1 to 6 millimeters, period. There is some evidence of lichenification and scaling, but no evidence of secondary infection or eczema herpeticule, period. These lesions are consistent with atopic eczema, period. Severe cerumen impaction in the left ear, period. Cerumenolytic solution was put into the ear canal and the left ear was irrigated with a saline solution after 30 minutes, period. A mixture of 50-50 mineral oil and saline was put into the left and right ear to demonstrate and instruct the patient on proper ear care, period. Dermatological exam revealed atopic eczema on the left elbow, comma, behind the left knee, and beginning to appear on the trunk and lower extremities, period. Patient was prescribed a 45-gram tube of mometasone furoate ointment and advised to apply the cream BID for up to 14 days on the affected eczema areas, period. Patient was advised to stop its use once the eczema was cleared up and to contact our office if there was no improvement after 7 days, period. The patient will return for follow-up care on these items as needed and will return for follow-up care regarding his other problem list items as scheduled, period. Click Next. And you can see the completed note. just the same as the previous example. Click OK. Click Close. And I'm going to continue to the next patient. Click arrow down. Click Open Encounter. Click Edit. Go to End. Macro follow-up. Chris is a 36-year-old male here for follow-up to review labs on his repeat lipid panel 3 months post-diagnosis of hyperlipidemia, period. He states that he feels very well today and has been taking his medication daily and following the low-fat diet and exercise plan that was recommended, period. Minor exam, all components are normal. Go straight to the impression and finding. I could have quickly reviewed the test results, as you know, and I can see that his total cholesterol was 241 and prior his total cholesterol was 271, so it's gone down 30 points, as well as looking at vital signs to see any weight loss, etc. And then complete my impression and finding. Chris was in last Friday for fasting labs, and I reviewed the results today, period. He is doing well on Crestor and is following the recommendations for weight management, which included a low-fat diet and exercise, period. Chris has lost 11 pounds in the last 3 months, period. His BMI is now just slightly above 32, period. We will continue Crestor and repeat labs in 3 months along with performing a liver function test, period. Chris will increase his water intake and try to cut out some of the sugary drinks he tends to drink, like soda and tea, period. Click Next. And I can add, if I know my measures, I can add my cholesterol screening PQRS measure to this patient as well, since we've done that. Click Next. Here you can see the medications. I could add a medication, or I can simply refill his. And I'll change it since he's coming back in that. So I'll change it to a 3-month supply since we're repeating the labs at that time. And I can see my instructions that are automatically built in, and I can tell him to schedule his labs for 1 week prior to his follow-up. Click Finish. Here I have a rule that's activated regarding his BMI, so I could close out of that and go add my BMI template so that I get more of my measures from Meaningful Use taken care of. So I'm going to go ahead and just load. It's already marked up my note with all the requirements. I've already counseled, so I know the requirements are to counsel and have a plan documented, which we do. So I can simply add it. If you weren't certain, of course, you could come through and look at some of the measures and items that were added to the note here. Delete anything that didn't apply. Click Finish. Click Close, and I can review my encounter report using my custom template. My plan and instruction on the BMI is under my impression and finding as well, along with under plan and instruction items. And it shows the measures that you've documented, either for Meaningful Use or PQRS. Click OK. Click OK. Click Close. And I could continue seeing my visits that way. Now let's look at some of the other components that Dragon Medical can assist with, like phone messages. Remember, you can always use the preview screen and quickly mark messages if that's appropriate. For this message, it's just a reminder about lunch tomorrow, but it does ask me to confirm, so I'll need to open it so that I can respond. Click Open. Click Reply. Yes, I plan to attend, period. Thank you for the reminder, period. Click Send. Click OK. Click Mark as Done. And that quickly I can respond to my mail messages. In this one, we have a patient that's asking for a medication since his eczema is not improved by the hydrocortisone. Click Open. Click Reply. Lisa, please send prescription for mometasone furoate ointment 1-2 and have the patient apply BID for up to 14 days, period. Have the patient call our office if there is no improvement in 7 days, period. Click Send. Click OK. Click Mark as Done. And I can get through my phone messages that way. I can do the same with my mail messages. You'll notice that the buttons are a little different. This is where setting up custom drag-in commands to access these buttons is necessary. I've already done that, so let's look at it. Just like phone messages, I can look at the yellow preview screen below. I may not even need to open this particular message. In this case, just reminding me of a meeting, and I don't need to open that. So I'm going to just mark this as read. Click Mark as Read, and it will update that message and bring me to the next one. Again, the same message, duplicated, so I can just mark it as read. Click Mark as Read. In this case, I may want to respond to the sender, and I'm going to do that. Click Open. Click Reply. These are my custom commands. So it's taking me to a position where I can just voice in my response. Kate, please let everybody know that I'm not able to make it today, period. I do have some notes on my desk that I would like you to review and present at the meeting, period. Call me if you have any questions, period. Thank you, period. Click Send. Click Close. Click Mark as Read. And that completes the mail messages. I can do the same for test results coming in. Click Open Result. To make a note on the lab, I can use the command click Lab Note. And here I can enter any notes that I want to be appended to this lab result, period. Click Close. Click Yes. Click Mark as Viewed. I could also forward the result or any of these navigation items that exist in MicroMD. Prescriptions is another area where we can use custom drag-in commands to process prescriptions, along with our MicroMD commands that exist automatically when installing drag-in, like this one. Click Process RX. However, there are multiple steps, as you know, in processing a prescription, setting it from requested to accepted, authorizing, etc. Once I have a prescription that's valid that I want to go ahead and just send all the way through to the pharmacy, I created a custom drag-in command to handle that for me. Click Process One Med, and that'll go through. I'm not doing anything further and just automatically approve this, including overriding any type of drug warning, and it's done. Other custom commands can be created to do the same when you have more than one prescription, like in this case we can see multiple requests, or 2 in this one. So using the preview screen allows you to know which command you're going to be using. Click Process RX. Here I can see the 2 meds, albuterol and Crestor. I can see over in the Smart tab when these were filled last. I can see my last visit date, etc. So in the case where I'm going to approve these, I would use my custom command created to do that. Remember, it's going to also clear through any drug warnings. Click Process 2 Meds, and the same process that you saw before on 1 will occur for 2 medications in this case. I'm not doing anything, it's simply utilizing the custom command created to navigate and process these prescriptions, including the send to pharmacy and the finish that'll complete and remove that item from my desk. I hope this presentation was able to help you see how MicroMD utilizing drag-in medical integration and custom commands can help you to efficiently navigate and to create custom visit notes, allowing you to better document your patient visits. If you have questions or would like a demonstration, please contact our office by email or phone, and we'll be glad to set that up for you.